Welcome to this special joint episode between the UNT Health's Life Pods podcast and the Vivos Therapeutics If Your Mouth Could Talk podcast. I'm your host, John McKenzie. I'm the Executive Director for the Division of Academic Innovation. Today, we're bringing together three experts from three disciplines: clinical nutrition, lifestyle medicine, and dental orthopedics to explore the complex puzzle of sleep-related health challenges. Would each of you take a moment and introduce yourself to our audience?
Oh, thank you, John. My name is Dr. Bahar Esmaili. I'm a VP of Clinical Innovations at Vivos Therapeutics, and I'm also the host of If Your Mouth Could Talk podcast. I have been a dentist for 15 years, but 10 years I practiced dentistry, and 5 years of it I devoted to becoming specialist in airway, TMJ, chronic pain, and I do a lot of research and development in terms of treating sleep apnea using orthopedic appliances.
Hi, thank you for having me. I'm Kovacs, and I am Assistant Professor for Clinical Nutrition program here at UNT Health Science Center in the Department of Personalized Health and Wellbeing in the College of Health Professions, and I'm also a registered and licensed dietitian.
Welcome.
And hello, I'm Cynthia Powell. I'm Assistant Professor as well as Engagement and Outreach Ambassador within the College of Health Professions, and I teach within the Masters of Science in Lifestyle Health Sciences and Coaching. My background is in psychology, organizational leadership, and learning. I'm also a National Board Certified Health and Wellness Coach, as well as a Certified Mindfulness-Based Stress Reduction Teacher.
Welcome. It's wonderful to have you all three. I can tell we're going to have a powerhouse of a conversation already today. So let's kick things off and maybe just open the conversation about each of your areas of expertise a little bit. Can you tell us what unique perspective you each bring to recognizing and addressing sleep-related health challenges? And let's start with you, Bahar.
I tell you that sleep has a special place in my life. Obviously, this is the rest of my career. And one of the biggest challenges we have with this condition is a lack of proper diagnosis, definition of what the disease really entails, and in how many areas it impacts the health and well-being. That's one of the challenges, John, that I come across every day. Mm-hmm. And at the age of patients that suffer from sleep apnea, breathing disorder, and sleep is getting younger and younger.
Mm-hmm. Absolutely. Robin, how about you?
Well, for me, as a registered dietitian, the most direct link between nutrition and sleep is definitely obstructive sleep apnea, because that is so highly associated with obesity, and weight loss is a effective strategy for helping to decrease severity of apnea. But the relationship in nutrition and sleep doesn't just end there. It is a very complex relationship that does translate into other chronic diseases, which medical nutrition therapy can help manage. So it's not uncommon for dietitians to hear of patients complaining of lethargy and fatigue and difficulty sleeping. So it's something that definitely dietitians can help to address in terms of diet quality and the things we're going to talk about today, but things that can help both chronic disease as well as sleep for improvements.
Absolutely. And Cynthia?
Well, as a lifestyle health and wellness coach, we tend to focus on an approach that is holistic as well as client-centered. So we first bring our attention to whole person health, and we look at the various aspects of an individual's lifestyle, including their nutrition, level of sleep, of course, stress level, movement, environment, and see how those various aspects impact their sleep challenges. And so we tend not to look at sleep challenges in isolation. It tends to be connected to lifestyle patterns as well.
Absolutely. And it's clear just from these opening thoughts that sleep is not one size fits all at all. And Bahar, you mentioned something very powerful to us in our prep for today, that sleep issues aren't the root, but rather the result of a larger imbalance. Can you unpack that for us?
Yes. So, John, what really is impacting the sleep is the connection between body and the brain, because one of the reasons why we do need to sleep is to allow our brain waves to slow down, to remove biological waste that the most metabolically active organ in our body, which is the brain, is producing. And that deep sleep is needed for that. For the brain to slow down and to go to the deep state of sleep, we need to have the safety of getting to the deep sleep. Anything that threatens the brain and is perceived as lack of safety will either delay, stop, or disrupt the deep state of sleep we so badly need. And the impact of lack of deep sleep is all the chronic diseases that we see that follows. One of the major ones is cognitive decline. And one of the major reasons of lack of safety for the brain to get to the delta is breathing, because there's nothing that is not impacted in our life with our breath. So obstructive sleep apnea is one of the major contributor to disordered sleep, which I like to call it disordered sleep breathing, not breathing disordered sleep, because the reason why they can't sleep is because they can't breathe. And that's one of the main focus that I put in. The first thing that I check is how they breathe outside of the sleep, the other 2/3 of life, because whatever you do during the day, that's what you carry to the 1/3. That's the most important.
Absolutely. You've described obstructive sleep apnea as a symptom and not a diagnosis. I want to ask you why that distinction is so important.
Because if you think about obstructive sleep apnea, the reason why we have a dysfunctional breathing is because breathing is the number one function we pick up the minute we come out of the womb. And the function of breathing is not just to get the oxygen into our lung, but basically getting that oxygen to every single tissue in our body, getting it picked up, and do the process of producing electrons with it, which is needed for vitality, electron transport chain, just to keep us alive. Now, that process entails a lot of other processes and procedures attached to it, from metabolic to enzyme function, and the ability of getting the circulation to get the oxygen to those organs, again, brain being the most important, requires the fluid movements. And that's where the posture comes into the equation. So if we call breathing disorder as just the one-sided thing, as in, oh, the airway just collapses, so we have to just keep the airway open, we miss the fact that when the oxygen makes it to the body, it needs to be delivered. And the whole process of respiration is not getting any amount of attention at all right now, because we're only defining the breathing disorder as if it's a problem with the upper airway, basically behind the nose or the nose itself and tongue. And I'm not denying that's the issue, but that's one of the. So I would call this a symptom, because then it redirects us to go back to the drawing board. What else is impacted? Where else do we need to look into?
So, Robin, I have a question for you. We often hear about weight and sleep, but not about the gut or neurological health. Can you explain how nutrition impacts the nervous system and sleep quality?
Yes, absolutely. So this topic really, revolves around the concept of the gut microbiome, which is, a hot topic and, increasing popularity in the past few years, and for good reason. It is very exciting to kind of understand how essential the gut microbiome is to human health and disease and the role that it plays. And a lot of that comes from emerging evidence that really shows us the link that exists between the gut microbiome, which is actually, been described as its own kind of vital organ in and of itself, in that it has this multi-directional kind of relationship or connection to the brain, for example, and other organs around the body that really impacts metabolism, immune system, neurological function. So it's really not just isolated just to gut health. It does definitely influence that, but it has more systemic, benefits and roles in the human body. So, and that definitely can translate into chronic disease if there's any kind of dysbiosis or altered kind of environment of the gut bacteria, the microbiome. And so dietitians are kind of trained to be able to educate clients and patients on the type of diet that is best for feeding those good bacteria and keeping the gut microbiome healthy. And in turn, that can help, a lot of other conditions, and especially, like neurological conditions, like you were talking about with the brain. It has been tied, dysbiosis has been tied with things like anxiety and depression and Alzheimer's, and even the dysregulation of the circadian rhythm, which affects sleep. So a really kind of broad emerging topic that I think we've only kind of scratched the surface to the impact that it has.
So Cynthia, in your coaching practice, how do you begin to uncover those lifestyle patterns that contribute to poor sleep? And Like, what kind of questions are you asking to get to the root cause with your clients?
Well, that's a really important question. The fact that what is paramount within the client-coach relationship is a safe environment, a place where they feel comfortable in sharing what their experience is. So first, we take a look at different aspects of their lifestyle and how it may be connected to sleep challenges that they're experiencing. Then as lifestyle and health coaches, we're also very focused on behavioral health and behavioral changes. So we help the client to investigate and hopefully remove any barriers that are connected to their lifestyle health behaviors that are contributing to the challenges. And then in the hope of empowering the client or the patient, then we work together to develop an action plan, if you will, that is aligned with their values as well as where they are in the change process, how ready are they, and also with their lifestyle. And then we provide ongoing support, and which includes check-ins. So we connect with them to help them stay on track with their goals, as well as adjust their plan if need be, if there are any changes within their life. So questions that we may ask include, what does your sleeping look like? How are you feeling in the evening before you retire to bed? How are you feeling in the morning? Is there anything that, you're thinking of in regard to lifestyle that may be impacting your sleep? So it really is about building awareness and collaborating and being a partner with a client or patient in moving them toward overall health and well-being.
Thank you for that. So each of you are clearly working with some different levers in addressing the problem: physical structure or food or stress or mindset. But each of these aren't just separate silos either. How are they interconnected is, another dimension that we can get into. And so, Bahar, let's bust some myths together.
Yeah, let's do it.
What are some of those most common misconceptions that people have, including clinicians have, about sleep apnea and its treatment?
The misconception is that sleep issues is related to, only is isolated to the 8 hours in bed, that it's not related to the rest of their life, and also the fact that it's a simple issue. And we all just looking at different angles here, because when body fails, when our health and resilience starts to decline, it will show up at the most vulnerable stage, which is our sleep. So if we really utilize the sleep and the quality of sleep as a marker of how you're living your life, we can create health. But unfortunately, with the lens of disease, we are only looking at symptomatology, and we're looking at only one aspect. We're focused on what's bothering you today. Most people that come to see me, they snore. So they want their tongue out of the way. They think that's the only issue they have. All the while, when I look at the sleep studies, there is 3 other things going on. Heavy metal mold toxicity is one of the things I look at, as we're talking about sleep transitions, gut microbiome issues. Most neurotransmitters we need for sleep stage maintenance is all made in the gut. So the first place we need to look at is the gut. If the microbiome are not functioning properly, your body is not properly functioning, and that does not get a look because we're looking at the snoring. I need to do whatever I can, whether CPAP them or push their jaw forward or open their nose in surgery, just to get that physical space open. That one-dimensional aspect of looking at the disease has prevented the overall arching 3 aspects of health: mental health, orthopedic health, and biophysical lifestyle health. It should all be considered together.
Absolutely. So, we've talked some about collaboration. We've talked about collaborating across professions. This podcast today is an example of doing that. What would you each say that looks like in practice? And let's take that in any order. What does it look like to collaborate in practice around addressing sleep?
Well, I guess I can start. So, for me, a lot of times working as a practicing dietitian, I would get referrals from, physicians usually for things like obstructive sleep apnea. But also, as I mentioned earlier, a lot of the chronic diseases that are diet related or diet linked, we provide medical nutrition therapy for diabetes and cardiovascular disease and metabolic syndrome and all these things, where we kind of, as we're doing a nutritional assessment, we uncover, issues with sleep. And so, definitely collaborating with the doctor in terms of as you were saying, not just thinking of it in terms of an airway problem, but how can diet impact sleep? Because it does make a big difference on sleep. And also sleep impacts diet. So as people are sleeping poorly and they're more sleep deprived, we know that this increases appetite and changes hormone levels. It causes cravings for kind of the wrong kinds of foods, and those foods are the ones that actually harm sleep the most. So there really is a complex relationship, bidirectional relationship. So definitely as a dietitian, you really have to work collaboratively with the whole care team. And that's really the best way we can provide optimal care.
Cynthia?
Sure.
I think I'd like to hear your perspective more because although you focus on the mental health, but to me, I think the broader answer I would say about the myth is everything is about the brain, even sleep. In fact, if we're sitting in here and looking at the brain is the first place to look at. So your perspective is really, really important.
Thank you. So I'll share as a lifestyle health and well-being coach, collaboration is really essential. The fact that we're looking for individuals who also have client-centered or patient-centered care in mind. We're also looking for interprofessional support system. So what's really important to me when I collaborate with other professionals is direct communication, as well as empowering the patient or empowering the client. When I see certain situations that cause me concern, then it's time to refer to other professionals. And that could be if there are chronic health conditions that aren't being properly managed, or if they have specialized needs, could be nutritional deficiencies, for instance, or if they're having sleep disorders or what have you. So it's important for a lifestyle health and wellness coach to know when to refer. And we certainly rely on our collaboration with other incredible individuals within the field. And the way that I look at value-based whole person care is really looking at the client or the patient as the center. And then we as healthcare professionals bring our specialized lens to help that patient or that client to achieve, optimal health and well-being.
The whole collaborative aspect of health, the reason why it's important, I love the analogies, you know me, John, is if I give you an example of a 3-leg bar stool, mental health, biochemical lifestyle health, hormones, and gut, bacterium, diet, and then orthopedics, each one of them is 1 leg. Any one of those that breaks, the system falls apart. So if your health is that bar stool, think about one aspect or 2 or all 3 could fall apart for one individual. Having a coach to understand the complexity of interrelationship of symptoms, which we talked about how poor sleep can result in poor food choices, which cause weight gain, which makes the sleep even more poor. And now you're depressed because you're not sleeping, and you keep going through this vicious cycle. The question is not that they're interrelated, because we know they are, is how do we approach this so that we can have a better chance at tackling the disease. And right now, OSA is something we can touch, palpate. It's a sticker I call, we can put it right here to say now we have something to go with. But if you think about it, how we live our life against gravity as bipedal species, and how we breathe and carry ourselves through the day, and what food choices we make, what news we'll listen to, what people we surround ourselves with, what practices we have spiritually or lack thereof, what family members we have, all that accumulation at bedtime, now we're in a vulnerable position. That's when it catches up with us and disrupts our sleep. And if your breathing is dysfunctional, now you have a problem, because you can go to deep sleep if your brain has been struggling to properly breathe and you're in a fight and flight all the time. That tiger that never showed up, and you're still fight or flight mode, low grade, and that just bleeds into other areas. I mean, we see young and younger children. We see middle school young children that come in, and the signs are written all over their faces. They are just sick, dysfunctional, not growing, and we're waiting for that title to stick over here and say, now you have a disease.
And I love your analogies. I love your capacity to use comparison to help really explain a complicated phenomenon. I recall one that you shared with us before around wet floors.
Yes.
And you were talking about what it's like to treat symptoms without first fixing the faucet. Can you tell us,
Yeah.
walk us through that
I
one
mean,
again?
this would make sense to anyone if, imagine, and the wet floors could be different for anyone. If I walk into your house and I see that, your kitchen floors are up to knee full of water, and, the wood floors are coming unglued, furniture floating is one thing, or you just have a little bit of a water. So yeah, one has so many symptoms and one has a little bit of symptoms. They both have wet floors, just more advanced. And right now the mode of operation is just, let's get the furniture all fixed, get the floors fixed, and get the water mopping, right? That's the mode of operation. Who could do it better? Who could do it better? We could do it better with surgery or CPAP or mandibular advancements, or no, I have a better rule. We can just give him a restrictive diet. But I'm always looking for, where's that water coming from? Well, we're looking at the sink. You could have a smaller sink or a bigger sink. Somebody have a small sink, smaller adaptive capacity, poor genetic, poor mental health to begin with, traumatized or what have you, and one have a bigger one. It can take a lot more before they overflow. And that sink is kink. Now the kink could be completely blocked or a little bit blocked again. And there's a faucet that's contributing to that water. It could be a drip or full-on running. Again, I'm just giving an example of range because a person that has a full-on sympathetic mode on in all levels, and their sink is small, and the water's up to your knee, I would treat them different than someone who has a little bit of a wood floor, larger sink, not quite kinked, and they have a drip. And the fact is, in all of those scenarios, we have to look at where is the kink in that sink, and where's what's causing that faucet dripping? Because if we address both of those two, we only have to mop once. And yes, there might be some repair done. When I was a dentist, I used to see broken teeth all the time, crooked teeth. And this is one of the reasons why I don't practice dentistry anymore, honestly. Because all I was doing was repairing those floors and mopping, and it becomes exhaustive. After a decade, I asked a very dangerous question: where's the water coming from? And that's led me up to this journey, that answering that question was not just in my hands, although every wet floor condition resulted in the mouth, hence the title of my podcast, If Your Mouth Could Talk. If I could chase every orthopedic, biochemical, mental health, believe it or not, nervous system dysfunction, it will manifest in the mouth, because the mouth is the most sacred part of our body. We use it for articulation, speaking our thoughts, for chewing. Its route of our breathing is going through our mouth, and also supporting us to stay on 2 feet. Practically everything that makes us become humans is manifested in our mouth, and it grows with us. And when you bring your view outside and look at humans in that scenario I gave, we start working together and put our biases aside. I always work first with chiropractors, nutrition. Definitely they need to have good nutrition and proper working gut and a good mental state to be a good patient before I can start doing my orthopedics successfully. So the big picture, as difficult as it is to attain at first, once you see it, it's impossible to go into your cubicle and say, I'm just going to pick up the drill or just look at the few things and just address them. It's almost impossible.
Mm-hmm. And one of the things that I love is that this is really voicing what probably shouldn't be, but is a new perspective on a problem that should be well understood and sometimes is, and with different audiences. And so, Cynthia and Robin, both of you have a role to play in training the next generation of health practitioners. Can you just tell us a little bit about what it is that you do when you're putting together a program and you're seeding that next generation of health practitioners? What does that look like from your perspective in the work that you do?
Well, I can share with the Masters of Science in Lifestyle Health Sciences and Coaching, to an extent, it was designed in order to redefine the scope of healthcare professionals. So beyond looking at treatment options, we also help to train professionals to look at prevention and behavior change, as well as whole well-being. So we really are interested in creating a cultural shift of sorts, where individuals in the healthcare field are focused again on prevention, partnership, as well as purpose-focused care.
Love that. Robin, how about you?
So for our Master's of Science in Clinical Nutrition program, it really is well aligned with the Health Science Center's Whole Health Initiative. So that our focus is really on really training and building up these registered dietitians to really understand the value and the importance of nutrition in whole health. It's it's a necessary component. As Dr. Bahar mentioned so eloquently, that it's a fundamental importance for overall health. So we have a very rigorous curriculum to really train how the value of nutrition in medical nutrition therapy, but also in counseling techniques and education and how to really individualize care. There is no one size fits all diet, lifestyle, prescription. It really has to be individualized. So we really we'll train our students in that manner, and also the value of interdisciplinary care. So we've partnered with the Interprofessional education practice and education team here, and that's going to give our students the opportunity to really from the start understand the value of a team-based approach, because that's the best way we can provide care. So they can actually interact with professionals from other institutions and other disciplines to really come together and really understand the value of working together as a team.
I can agree more, because what we put in our bodies is the main source of inflammation. And when we said one size doesn't fit all, for someone who cannot properly process avocado, and avocado becomes the oxidate, produce the stress in their body, we look at lifestyle as if it's a one size fit all. And nothing is a one size fit all. To look at two human beings and they could look the same as far as symptoms, they both arrived at it differently. And the approach need to be individualized, because the only way we can address people as individuals is to look at their process, symptomatology, and individualizing them, because the approach should be who does with what, when, and how. The paradigm that is on the treatment first, depending on who you go to, becomes hammer and a nail situation. For a man that has a hammer, everything is a nail. And unfortunately, 2 years down the road, when you're not getting the results because we didn't look deep enough, the only place that was for that patient is, a prime example of that is concussion, which is one of the main things that I treat with patients with concussion. They have a sleep disorder, both disordered breathing and also insomnia to some degree, and they have poor quality sleep. And one of the reasons for that is that whatever that impact of injury was, it's both mental health related. They have disruption in brain waves, fluid around the brain, and also disrupted breathing and respiration. So which one of them do we tackle? Well, the fact is, where did the body take it and rearrange itself? To unwind and reverse engineer, we need to understand how they got there first. And the rush to the treatment, unfortunately, in the allopathic methodology of treatment, which we all learn, that's how I learned. You look at holes in the mouth to fill them. You look at malocclusion and broken teeth. But how to create the health picture of the health, if you ask the question of, here are the metric of disease, which one you have? We look at disease, we look for a disease. But if we reverse that and ask, what does health look like? Health is a resilience factor, and resilience is a combination of all things in every level.
So Bahar, let's expand a little bit on that last piece. Vivos recently expanded into sleep clinics. What's the vision for bringing your model of integrative care to a broader medical audience?
I love that question, John, because one thing we notice as a company, and I have the last 5 years that I've been specializing in airway, is that patients that have obstructive sleep apnea, first of all, they don't get the proper diagnostics, even though they have the metabolic syndrome. Even though they have all the other signs and symptoms, sleep doesn't get checked. And even if it does, they get a referral to the sleep clinics or sleep specialist, and the first thing they get is a CPAP option. And unfortunately, if they only look at sleep issues as if they just have a problem with an airway that's collapsible, we're not looking at the root cause of things. and the root cause that's really down the stream from structural imbalances, chemical imbalances, even mental imbalances and brain waves, we basically are just ballooning that area open, hoping that they're going to get better sleep. And that's not working. Matter of fact, I would like to share with you a little bit of a brief history of the mode of operation. 2021, the gold standard of obstructive sleep apnea treatment, which is CPAP, had the major recall from one of the major manufacturers, Philips. They had an issue with the particles released from the machine into the lung. So they, believe it or not, one of the biggest recalls from FDA was issued. So now Medicare and Medicaid, that are one of the biggest payers, they wanted to see the efficacy of the treatment they've been paying for, because everybody follows Medicare and Medicaid. They hired an agency for quality research to find out if it's efficacious, people use it, and does it address all the other chronic diseases that it's supposed to, the comorbid conditions. The report came back surprisingly saying it doesn't. It reduces some of the accidents on the road, but it doesn't seem to be effectively reducing all the risk of stroke, cardiovascular disease, high blood pressure. Part of the reason is that because of the compliance. You know the average time that patients actually do use their CPAP? Would you like to know the stats?
I'd love to know.
3 hours a night, 3 nights a week at best. That's the best. And 5-year follow-up they don't even use it after that. They either show up on eBay, in their closets, or they throw it away. It's not pleasant to use. And right up with it, mandibular advancements with the pushing the jaw and the tongue forward are right up with it. So we have a gold standard that has the major recall from one of the major manufacturers that now we prove is not working. And while we're at it, we see that other options are not working either. And that's all patients are getting. Now that we are understanding that this devastating disease, or I would call it dysfunction, that's impacting health, is getting just one stick thrown at it, this is why we are here. Because if you really bring the full picture of where the body is failing, these people get a chance. And most of them, to my delight, they don't even need the CPAP anymore, even if the CPAP was working for them. And some of them do continuously wear it during the treatment. Once we address their breathing disorder, the need for CPAP when their apnea-hypopnea index, which is the metric of OSA, drops below 10, they technically don't need it, and most of them don't. And that's what I'm excited about what we're doing, because it's about time for medicine, dentistry, and all other aspects of health, other professionals come together to share angles. Because I don't have the perspective that you guys have. And I'm pretty sure you're wondering why I'm sitting here with the skull.
Yes.
Because you need the perspective of, I think it's a beautiful centerpiece.
I think it's a beautiful centerpiece too. And as I recall, one of the things that you were going to help illustrate for us is related to the importance of resilience.
Yes.
And this skull is going to help you tell that story.
The fact of the matter is, this is beautiful, because that's how we were supposed to be. And if you see the shape of this skull, and it carries all of our sensory inputs, eyes, ears, vestibular system is in our temporal bones, and how this is even oriented on top of our spine, because we stand on 2 feet and we are bipedal. And our mouth is the other end of the chain of our closure with gravity, because when we've put our feet on the ground, the rest of our spine and our body is basically organized underneath the skull. To be exact, this top, I call it the roof, that's my territory, the maxilla. So if this is beautiful and perfect, but we look at humans that they have either half of their faces is smaller, or their jaws are shifted, ears, eyes, and they're not symmetrical, they're just uneven. So if you think about it, everything is out of order. So to get everything balanced, while they still breathe and stand on 2 feet, they take so many layers of compensation. So let me demonstrate that real quick here, because imagine this is a modern human, okay? What's inside is what you see. Hormone health, gut health, mental health, resilience, what's inside we're keeping. The structure of this bottle is our posture, our fascia, our bones and muscles, and holds us together. And the very top of that is my favorite territory, tongue, and the roof, right here. So if you think about this is half full. It's not completely full. And it's been going through some life, maybe it's halfway through life, and has lost a lot of its resilience. And imagine this top part being the airway. So if going through life, the posture is not perfect, and to balance itself, it contorts. This is your forward head posture, okay? And as it goes through life, right, it's leaking, like literally leaking as we go. This is why people have chronic fatigue, because as we're going through life with compensation, we're losing that. But the most devastating part is when we have a leaky system and it's in bed. That's when it's supposed to recharge, but it's losing capacity and it gets worse, okay? I'm just going to take away some of that adaptive capacity. That's what happens every night. We're losing some, go through the next night. This is not a system that can withstand what's from outside. It doesn't have resilience, not full, and continuously losing that resilience. What is the mode of operation right now? Oh, yeah, let's give him CPAP. Perfect. There's no problem. Tonight. Until tomorrow night. Goes to bed, losing more, right? You know what's going to happen if I keep doing this for another 10 years, 50 years, what have you. And if we only approach this from one end, from a dental aspect, let's say give him mandibular advancement, let's just address just the top. This still does not look like what I like to call resilience. This thing can go in any direction, put pressure on it, it can hold itself. It has its tongue to the roof, it has this structure in vertical, horizontal. You fill it up, you give him the nutritions and the peptides and mental health support, and it will hold. The structure and what's inside need to work together. I'd like to be 100 years old. I'm sure everybody wants that. You know, you want to have kids and grandkids and hike and live, not like this on oxygen and 15 lines of medications. And every time we perform surgery on this thing, we're producing another fork in the system, even though they come to me in my team of approach to Vivos, and we're still trying to put them back together. I cannot give them those molars and premolars, the wisdom teeth that are removed. I can't give them half of their, soft palate that was removed or half of their septums that were removed. An attempt to open up their airway, because all we looked at was, it's a one-dimensional problem. They can't breathe through their nose, cut everything in the nose. Cut everything until there's nothing else to cut. And this approach of creating the perfection in a structure, which really though it's as humanly as possible, we can get the skull or the faces and structures together and put the head over the center of gravity with the proper spine. That's a good start. And then I hand them off to other folks that address their nutrition, inflammation, health, mental health support, and what have you. I hope that you love my demo.
I do love that demo. I was about to say you're a poet. I mean, there's the power of analogy, the power of metaphor to really make a complex issue understandable is very powerful. So, this raises a fantastic next question for the group with all of that kind of elevation of an understanding or explanation of how this process works. Let's go back to the very basics. If someone walks up to you and just says, they visit you in your practice, I can't sleep. What do you do? Where do you start? And Robin, let's start with you.
Okay. Well, we've all, as this has shown us how complex that question really is.
Right.
But coming at it from the nutrition aspect, my initial questions would be to, really get a foundational knowledge about their dietary patterns, their style of eating, their relationship with food and how they're feeling and, what are, potentials for deficiencies or what their diet might be lacking. Because we do know that a high quality diet does support better sleep. And, as we've talked about here already, that relationship with nutrition and sleep is very complex. So, but it also not just is about what they're eating, but how much and when, timing of meals and snacks can play a big role in sleep. So it's really about analyzing multiple aspects of nutrition and their dietary pattern. And then also, further seeing what else might be influencing that and, who they might benefit from seeing also if stress and other lifestyle factors are also going to play a role too. So referrals. And so that's where I would start.
Absolutely. Love that. Cynthia, how about you?
Well, as a lifestyle health and wellness coach, it's important that individuals realize that we don't come in and just fix the problem. Mm-hmm. We're really focused first on establishing, a partnership, a safe space, again, where individuals can feel comfortable sharing what their life experience has been, what their lifestyle habits are. And we focus on establishing trust, and help the client or patient to understand that we are their partner in this journey. We're not going to fix their problem. So partnering with them, recognizing what their lifestyle habits are, what their values are, where they are in regard to being able to make significant changes in their life. So it's really about increasing awareness, partnering with them along this journey of discovery as they move forward and make adjustments in their lifestyle health habits.
I love that, empowering them to find the path to that solution that they're looking for,
Yes.
as opposed to saying, I'm going to show up and fix it for you.
Exactly. And about 70 to 80% of chronic conditions are connected to lifestyle health habits.
Mm-hmm.
And so that really highlights the importance of a personalized, interprofessional, as well as purpose value focus on care for patients and
Exactly,
clients.
the choices they make. And if we're thinking about our bodies as cell phones we charge, right?
Mm-hmm.
If your cell phone, for whatever reason, is not holding the charge, if by 3 o'clock in the afternoon you have to do something to keep carrying through lifestyle choices, most people do recreationals and they go do yoga and they have to go for a run. Something else is lacking, and that's the way of just getting through, which negatively impacts them. If they have orthopedic issues that cause their problems in breathing, in sleep, and pain, and all that, now they're exacerbating in the name of compensation. And partnering with them is important because people have been very much educated that your doctors have the answers. If your tooth hurts, your dentist should fix it. I never bought that narrative. By the way, I was never able to answer why they broke their tooth. And that's why I couldn't do dentistry anymore, because I did not buy into the narrative that you have 28 other teeth. Most humans don't have 32. 28 other teeth. Why do you keep breaking the same one? I used to tell patients, you have other teeth too. You could break one of those next time. Why do you keep breaking the same tooth I fixed? The problem was when they have a malaligned pelvis and they put the forces from the ground up on one side of their body's completely sympathetic. That's the side that gets hammered. They overutilize one side. Their breathing is dysfunctional. Their vagus nerve is down. Their digestion is also down with it. And then they make 3 other poor choices because they don't know it's coming from there. And when we did things in dentistry and caused their neck problem, I never knew that. I didn't know that their neck hurts. The fact is, patients need to be educated. They need to know their bodies are complex. Their symptoms are not isolated in one area, and their bodies know how to fix it. Because as much as I called health as resilience, really health is not. I want to also say what it is not. Health is not absence of disease. Health is not absence of symptoms. Health is having the capacity to adapt to changes in a physiological range when you're doing this subconsciously and you don't know. Like if I have $10,000 money in the bank as reservoir of capacity, resilience, if I spend $100 that's, not legit, I don't get a call from the bank. But if you are overspending, your sympathetic is just draining your bank account down to $10, you'll get a call from the bank. That's pain. That's symptom. The brain saying, I cannot put any more pressure on that shoulder anymore. Frozen shoulder. Where do we go? To the physical therapist. Oh yeah, let's relax these muscles until the next breaker goes on, until the next breaker. And we have people coming around at age 50 and we say, that's just normal aging. The fact is, our bodies are going through way more stressors, way more toxicity and stresses from the world. And we have running out of ways of adapting to them. And we have sicker people with chronic diseases that we don't know how to tackle. And this is the only way we get a shot at it. This is the only way that I know how to get a shot at it, to get people somewhat of a normalcy of resilience back.
Mm-hmm.
Yeah.
I love the conversation that we've been having. We've really been able to dive deep into so many different aspects of the challenges that sleep can bring to us, or that sleep that lead to disordered sleep. Let's have some final takeaways. And Cynthia, let's start with you. If you wanted our audience to have a single takeaway from today, what would that be?
I would share one of my favorite quotes from Eleanor Brown, which is, self-care is not selfish. You cannot serve from an empty vessel. And this is more than just a motivational quote. It really does take courage.
Mm-hmm. Absolutely. Robin, how about you?
I definitely think it's really important to just for people to know that they have to advocate for themselves. And, I think this is knowledge is power, and understanding that, symptoms you might be dealing with are not usually isolated. They're usually very complex and interrelated. And to really understand the importance of whole health and seeking out ways to get referrals so that you can have experts come together to help you achieve that whole health.
Thank you. And Bahar, the last word goes to you.
Thank you. If I were to talk to any patient, if they'd reach out to me, or if this message gets to their ear, first of all, I want them to know that there are options. They should advocate for themselves, ask questions. They don't have to manage their disease. They can create health, change your perspective. And if your doctor does not embrace a whole health system and are not asking questions outside of your symptoms of what they're related to, maybe you need to look for somebody else that does, and look for those options, because now we have more. And this is merely a reason why we're here. This is why Vivos is expanding their territory. So there's hope. Ask questions. I would encourage them, educate yourself and ask questions.
Well, thank you. You heard it here. Thank you for joining us on this joint episode of Life Pods and the Vivos Therapeutics If Your Mouth Could Talk podcasts. For more information, resources, and links to each of our guests' work, check the show notes. And remember, good sleep isn't just about rest, it's a window into our whole health.